Migrants, or people who move around a lot, are at a higher risk of contracting HIV. And it's not because of where they come from, it's about the circumstances they're moving into and what they leave behind. Many migrants come from countries like Somalia, Malawi and Mozambique, with lower HIV infection rates than South Africa. And when they come to South Africa, they face an increased risk of contracting the virus because it's so much more prevalent here. But the risk doesn't end there. Moving to a new place also means leaving behind family and friends. In other words, a migrant's social network. Without this kind of support, they may be more likely to rely on dangerous ways to cope with stressful situations, like alcohol abuse, which may lead to unprotected sex. Research has shown that high levels of drinking makes people more likely to have sex without a condom, which increases their chances of contracting HIV. Migrants face another precarious situation. If they contract HIV in a country of which they're not a citizen, it might be difficult for them to get the health care they need. In South Africa, the law says that everybody, regardless of their documentation or their nationality, can get free HIV and TB medication at government health facilities. But discrimination from health workers and locals can make many migrants reluctant to seek out care, often until they're very sick. Often migrants can't take time off work to go to the clinics. This is because they're employed informally by contractors and don't have paid sick leave. A study conducted in Lesotho found that people who moved to South Africa for work were 7 times more likely to stop taking their HIV medication correctly than those who worked close to home. And even when migrants are able to get their HIV medication, stigma might stop them from taking their pills at work where others might notice. When people take antiretrovirals at the same time every day, the HIV in their bodies becomes so low that it's impossible for them to transmit the virus to others. But for people on the move, taking these pills correctly is no small feat.